CT Protocol of the Week. I figured this time we do something a little different, so let's get into it, shall we? I know this concept I've talked about more than once, but we need to keep talking about it because it is super important when you're new in CTs. So we are going to be talking about patient centering the correct way. Now, why is patient centering very important? Because this is going to calculate your dose when you scout your patient to administer the correct amount of dose for any type of CT exam. So your laser light, this is super important when you're scouting your patient for any type of CT exam to make sure they are centered properly for that scout. So your laser light kind of looks like this. I took the liberty of making an example of the X and Y coordinate. This is actually what your crosshair will look like from side to side and top to bottom. Your Z-axis is the most crucial step when it comes to centering your patient correctly with your laser light. So you want to center your patient at the mid-sagittal plane so that the patient is lined up correctly. Most CT systems take two scouts, so one at 0 degrees and one at 90 degrees. So your dose is going to be determined by your scout if you center the patient correctly. So dose is calculated from the top to bottom of your scout, so that's at 0 degrees. And then on your Z-axis, so from right to left, left to right at 90 degrees. One factor that will completely throw your radiation dose to your patient off, if you center them too high or too low, it will increase the amount of radiation dose that is administered to the patient. So one important concept is to make sure that you center them correctly so the system calculates the correct amount of radiation dose. A couple of key concepts that I want you to remember is use your laser light. It is your friend. It will go ahead and make sure that your patient is centered correctly so the system calculates the correct amount of dose. And when in doubt, rescout. Hope that helps.